Manhica Health Research Center was established in 1996.
This is a joint initiative between the governments of Mozambique and Spain.
These two governments have been funding the structure, which enable us to then go out, look for competitive funding. When we started here, we had only one project. Right now, we have close to 70 projects running simultaneously.
Malaria was the first focus disease for seismic. Then we expanded to include HIV and tuberculosis, diarrheal disease, upper respiratory diseases, and the others. It's special because it's directed to find solutions to the problems affecting the country.
We try to be relevant for the policymakers. What gives us a comparative advantage is our research programs mirror the main public health programs in the country. Research in malaria, which TB and HIV, mother and child health, and also bacterial, viral, and neglected tropical disease. We also do a lot of epidemiological science, the frequency and distribution of disease, who gets disease, and try to, find out why.
We also have clinical trials to decide on which intervention are suitable for our population.
We were hugely affected, but we also took measures to make sure that we're able to participate in national response to the pandemic, and we also attracted new projects.
We are contributing to generate evidence to feed the National COVID Committee on that.
We have a big component of social science as well. We call it population health. Manhica has been part of a network of research centers in Africa that have demographic surveillance systems.
This is a platform to help trace the population for biomedical research.
We do community engagement, mobilization, sensitization.
We do demographic research, we do anthropology.
In general, social science research.
Any big project wants to know whether that intervention will be accepted or not by the population.
We bring research evidence about the health of population, and we also contribute with evidence on which interventions are acceptable to implement.
So we support 8 health facilities here.
We contribute directly to the populations that are living here.
So population of the district benefit from improved medical attention.
But the main impact is through evidence generation that is used to help guide policy making.
In malaria, for instance, in monitoring regularly the protective efficacy of the current used drugs, because it helps telling the Ministry of Health if there are any signs of resistance, it can be changed. Manhica Health Research Center is one of the best training places here in Mozambique, especially for those who want to do research as a career. We came here without knowing anything about research, and we started learning it by doing, and now we are able to lead projects.
We have what we call training fellowship program. We attract young talents from the university, and some of them end up staying with us.
I was privileged to be funded by Edctp at the beginning of my career. I was granted career development fellowship, and it made me in the global health arena.
I have been involved in the Trials of Excellence in Southern Africa project funded by Edctp. We had the opportunity to strengthen the human capacity to be able to conduct clinical trials and to have more than 70 master's and PhD students.
We have a lot of support from the international partners, and Edctp is a very relevant partner to us. Now we are at the level of 21 projects in which Edctp is associated.
In the first phase of Edctp, we as a country benefited about 2.5 million euros, and almost 9% of that went to capacity building. In phase 2, the total amount of funding went to 10 million, including research, capacity building, and also partnership and networking between institutions.
Now I'm leading a project that aims to evaluate if mass drug administration can be a strategy to be used here in Mozambique. This is a project funded by Edctp.
I think apart from funding, the Edctp also have a large capacity building support. Being alumni from Edctp gives me an opportunity to go to a step more because now I'm a reviewer and give feedback to the researchers that are involved in trying to get these grants. As I'm happy that I can help reviewing the grants and giving that support for the Edctp.